Hey everyone, so it's Michael here at Home Health Success Academy. So I just wanted to give you guys a quick video. I'm on hold right now in a phone call, and it's been about 30 minutes since I'm on hold. I'm not waiting for a referral, I'm just on hold for another personal thing. But while I was on hold, I was actually reading an article that was very interesting. And if you as a home health agency, whether you're an owner, an administrator, or let's say you're a marketer for a company or a liaison, you know, you want to be able to keep yourself informed about what are the different changes that are going on right now, especially in our industry. And what Home Health Success Academy does is we help, companies learn how to be able to market their company, learn how to be able to increase their referrals and increase their census, and to be able to get that amazing company that they deserve. You know, one of the biggest problems is the marketing in home health agencies. They don't know where they're going to get the next patient, and that's what we do here is we solve that dilemma. We solve that problem for a lot of the agencies by giving them an outlook to be able to know where to go, how to go, and what to do. So with all that aside, I want to be able to share with you guys this quick article that I actually read. So, it is actually from the healthcarefinancenews.com, and you can actually see, the printout of the CMS proposals and everything. But you can also go to other websites where you can actually view this. So, what's going on right now is that CMS is proposing to place a 1.72% cuts, okay, in pretty much home health payments. So that's pretty much they're saying if they can do this, they can literally save the government $350 million a year. All right, $350 million. And the U.S. government does need some help a little bit regarding to try to cut these costs. And this $350 million can be helpful. But a lot of agencies are having big problems with this, and they're complaining, and but they have every right to do this because that's loss of revenue, and if we look at it, let's say for example, a standard home health agency, okay, a standard home health agency, let's say if they have 100 patient census, in a monthly basis, this literally is a potential loss of about $4,000 a month, and which could also equal out to about $48,000 a year. Now that's a lot of money. But let me tell you guys this. It's actually okay. It's a good thing to have this. And a lot of you guys are probably shocked, and a lot of you guys are saying, "What, Michael, how dare you say this? This is not good for business." Well, I want to be able to compare you guys to another industry, which is the real estate industry. And during the good times of the real estate boom, what was going on is you had what they call, pretty much wannabe realtors. These people, just because everything was good and great, money was flowing, banks were giving loans, and people were buying houses left and right, that it was easy for them to do that. So they just had to say that they're a realtor. And I got a license, I got a realtor's license, so I can now sell houses. Well, that's the biggest problem, because times are good, everybody is gonna jump into that market. And in the home health industry, I am sure that you feel, wherever you are, whether you're in Texas, Florida, Wyoming, Maryland, wherever you are, you feel that your area is pretty much compacted. There's so many people over there, so many agencies that are competing for these patients. And maybe it's gone to that point that maybe there are a lot of home health agencies. And with that said, is the wannabe home health agencies, just because patients are abundant, they're all there, the payment's high, they can afford to be able to not work too hard to be able to get their patients, to be able to get those referrals. Now, what happened was, when you had the real estate bubble that burst, all the wannabe realtors left, okay? They're gone. They had to go because they could not sustain themselves. There wasn't customers, there wasn't, any people getting approved easily with their loans. And so the ones that are remaining are the pros, the ones who are good at what they do, the ones that are willing to stick and literally dig their feet into the ground and say, you know what, we're here in this industry. We're the real realtors out there. And that is, and that's shown good for them, because I know a lot of realtors now, the real realtors that are successful, making more money now than they actually did then, when it was easy to get, those referrals. It was easy to get those people buying the homes, getting approved. So it's going to be the same exact thing in our industry. As these cuts are happening to us right now, it's a good thing. The agencies that are great at providing amazing care, the ones that are great at marketing their agency, the ones that are great at being able to, let people know about their products, their services, so that they can get those referrals from the hospitals, the nursing homes. And so don't forget about the new 5-star settings right now for home health. You need to be able to not just say that you're a home health agency. You should be able to prove it through your services. But for you to prove your services, you need to be able to serve patients. So you need to be able to have great marketers, a great process in your company, great management, so that you can have an amazing company. Now, a lot of people say, well, Michael, $4,000 is hard to lose. Okay? It's really hard. I have 100 patients, and, $4,000 is too much money to lose. Well, I can literally guarantee you this, is that if we look at your company, that if we look at the process that you're doing, that we can literally find ways for you to be able to save money internally. I've worked with agencies out there that are overpaying their visiting nurses, that are overpaying the therapy companies. And that is one of the biggest problems is right there, is that your process, okay, your process is, there's a little stuff that we can fix on that. So we have to look at, what are you paying your nurses? Because imagine that if you have 100 patients a month, okay, if you have 100 patients a month, and you can actually make sure you reduce the payments to your nurses. Now, I love nurses. I'm a nurse myself, but if you're a business owner, you need to be able to learn how to be able to not just pay everybody out there full payments. They need to be able to be paid depending on um, their experience, on their work, the workloads, on how they perform. You want to be able to make sure that you have the great nurses, to be able to make sure that you are able to provide great care, which makes sure that the referral sources would enjoy you guys. So we need to look at your process. We need to look at your people. Okay, and I will guarantee you guys that you can literally tweak a few things and to be able to make sure to make up the difference. And if you can improve the process of your company, and that's something that we do here at Home Health Success Academy. Whether you ask us to come in to be able to help you guys, and we've come to companies and have shown them that they can save around $50,000 to $60,000 by just us walking in right there and looking at their process. Because if you can improve your process, you can increase your profits, and at the same time as you can actually reduce the costs of anything within the internally of your company. Now, another thing also to look at is this, is that look, things are changing in our industry right now, okay, and you need to be able to have multiple sources of referrals. Are you just relying on nursing homes? Are you just relying on maybe a few physicians? Are you just relying on one hospital? Let me ask you this. When was the last time you actually visited a potential referral source that you've never seen before? When's the last time you picked up the phone call to try to get an appointment? When's the last time that you actually went back and called a referral source that was used to give patients to you a year ago but doesn't give you patients anymore? You need to be able to have a process other than how to manage your company, but at the same time as how to be able to run your marketing team, how to be able to make sure you watch what they're doing. And I'm working with several softwares right now, and I would love to be able to also share with you guys some software companies that has made it cost efficient for companies like yours, and at the same time has added so many amazing stuff within the EMR system that if it is actually used, you'll be surprised how much money that you guys can save. From being able to have your HCAPs already connected with the EMR services, or how to be able to speak to your patients, or to be able to speak to your nurses, how to be able to monitor them. There's so many different things that you can do within your company, and I want to be able to share that with you guys. So, make sure you give us a call. My number is 630-340-8990. That's always going to go directly to myself, okay? And visit our website. Just go to homehealthsuccessacademy.com. I also recommend you guys to go to youtube.com and literally enter home health marketing, and you'll literally see more than 90 of our videos that are going to be placed in the first 5 pages in YouTube. And we also do that. We also help agencies learn how to be able to get their videos on the front part of the YouTube selection, because most people, when they're searching for something in YouTube, most people are searching by videos now. They will literally search just the first 3 pages. And I've literally proven it to people where I've had pretty much almost all my videos in the first 5 pages of YouTube when you just enter home health marketing. So, like, our job here at Home Health Success Academy is to be able to help you have an amazing company. I hope this quick video was able to, give you guys some guidance a little bit and give you guys some advice that don't look at this cut as a bad thing. It's a good thing, because the other agencies who are not great at what they're doing, they're going to shut their doors down. Imagine you lose one agency or 2 agencies in your area that doesn't want to learn how to market their company, doesn't want to learn how to be able to improve their services for their patients and for their referral sources, and they shut their doors down. That's more patients for you guys to be able to compete with, right? But it's still a great thing. So don't look at it as a cut. What you need to do is to be able to look at something that's negative like this, that everybody feels are negative, and all they're going to be doing is complaining. Let them complain. Don't complain, and look at how you can actually take advantage of something like this in front of you. And that's what I actually do. I don't look at negative things. I look at where I can improve things if something is placed in front of me. Remember, when the government says that they're going to do this, and they do this, are you just going to keep on complaining about it, or are you going to create action right now? So one thing I'm going to ask you guys to do is this. I want you guys to call 3 physicians today that you've never spoken to and try to get an appointment. I want you to call 2 nursing homes, all right? And then I want you to call 3 assisted living communities right now. And I want you guys to do that within the next hour. I challenge you guys to do that. And if you guys have problems on how to be able to go past those gatekeepers, give us a call over here at Home Health Success Academy. We're going to be able to help you guys get referrals, increase your census. So first of all, I got to go. I'm still on hold with this phone call right here. But I'm glad I was able to share with you guys a quick, marketing tip. If you guys wanted to look up that article I was reading, it's in healthcarefinancenews.com. Once again, healthcarefinancenews.com. So this is Michael Echeverry with Home Health Success Academy. Understand this: home health marketing is not hard if you know what you're doing. Give us a call. Have a great day.